Good afternoon, everyone. Thank you for joining us for the special program with Dr. Emerson on prevention and treatment of Alzheimer's disease. And so this is the third lecture this weekend, and we're excited to see what we can do to reverse Alzheimer's disease. So let's bow our heads for an opening prayer. Dear Heavenly Father, we praise you for this beautiful sunny day. We praise you for all the wisdom that you have given to Dr. Emerson, and we're so excited to learn more what we can do to protect our brain and how to help people who already have Alzheimer's disease. And so we ask that you may be with us and that you may help us put all the information into practice. And it's in Jesus' name we pray. Amen. Okay, Dr. Emerson, thank you so much, and please take it away.
Thank you. All right, well, glad to see you here. We're going to talk about reversing cognitive decline. So last night we talked about how to prevent it, and of course, when you're talking about treating it, you want to do the preventive medicine, or the preventive approach, as well as what we're talking about now. So last night we talked about prevention. This morning we talked about what does Alzheimer's look like? How do I know if I might have it? And then what's the workup for that? Now we want to talk about, okay, so you've been diagnosed with probable Alzheimer's. Now what do we do? Let's see here. Okay, so, Okay, so what is Alzheimer's? Well, here's a normal nerve. It's a little bit of review. And on the right there, you see the amyloid plaque, which is next to the nerve cell, and that's what appears to be blocking transmission from one nerve to another. That's Alzheimer's. There are 4 available Alzheimer's drugs. The first 3 were donazepam, rivastigmine, galantamide, and these are called cholinesterase inhibitors. We're talking mainline therapy for Alzheimer's. How do they treat the symptoms? Well, in Alzheimer's, there's a defect in acetylcholine. When one nerve wants to signal another nerve, it releases acetylcholine. Acetylcholine goes to the end of an axon and goes across the synapse, across a gap, and hits the other axon to the next nerve, and that turns it on, and it sends a signal down the nerve, and that's how a nerve gets transmitted. It jumps across a gap, and the molecule that jumps across the gap is acetylcholine. Now, you don't want, once you send the signal across, you want to destroy the acetylcholine or it'll keep sending signals. You just want to send one signal. And so the body has an enzyme called cholinesterase, which breaks down the acetylcholine once it's done its job and signaled the next nerve to send a signal down the pike. So what they've done with these drugs is back up. In Alzheimer's, there's a defect or a decreased amount of acetylcholine to go across the gap. So what they've done is they block the acetylcholinesterase, the enzyme that breaks down the acetylcholine, to try to increase the acetylcholine levels. Now that can treat the symptoms for a while. because it will increase the acetylcholine levels. So symptoms may get better for a while, but shortly thereafter, the body responds by making more acetylcholinesterase. So pretty soon the drug stops giving you any improvement. It's a temporary fix, so to speak. It does nothing to slow down the formation of the plaque, the amyloid plaque, or the tau proteins that are formed in Alzheimer's. So that's the first three drugs. The fourth drug is called memantine. It's another neurotransmitter. Excessive stimulation of the nerves by this neurotransmitter can actually kill neurons. So the drug memantine works to decrease the excess stimulation by the neurotransmitter glutamate. Unfortunately, it may inhibit the very neurotransmission critical to memory formation, and so may initially impair cognitive function. Memantine appears to have modest benefit in patients with moderate to severe Alzheimer's dementia. A 28-week randomized trial found that memantine significantly reduced deterioration on multiple scales of clinical efficacy. Memantine appears to have modest benefits in patients with moderate to severe Alzheimer's. That is, it only slowed the decline. It didn't stop it, and it certainly didn't reverse the decline. It just slowed it down. A genuinely new Alzheimer's drug has not been approved since 2003, and the currently approved Alzheimer's medications are ineffective in stopping or slowing the course of the disease. Now, why are they ineffective in stopping or slowing the course of the disease? Because they only treat the symptoms, not the cause. It's kind of like you've got pneumonia, I get a fever, we give you aspirin to treat the fever, but that does nothing to get rid of the infection, the pneumonia in the lungs. Why are they ineffective in stopping or slowing the course of the disease? Because they only treat the symptoms. Have other drug approaches been used? Well, seemingly rock-solid evidence from lab rodents suggests that Alzheimer's disease is caused by accumulation in the brain of sticky synapse-destroying plaques made of a piece of protein called amyloid beta. Those lab studies indicate that amyloid beta is formed in the brain by a series of steps that either interfering in those steps or destroying the amyloid plaques should be an effective way to treat or even prevent Alzheimer's disease. Following this line of reasoning, since the 1980s, drugs have been developed which either block the synthesis of beta amyloid to remove it, or they try to remove it effectively in an attempt to improve the symptoms. But patients either got no better or they got worse when you destroyed the amyloid plaque, or even if you prevented it from forming. Needless to say, with those results, none of these approaches were approved for sale. So let's look at a different approach. So if the following is a summary of the research done by Dale A. Bredesen and described in his book, The End of Alzheimer's. We've used most of his recommendations. Some of them we've used some additional insights we have from Spirit of Prophecy to kind of hone down the process that's recommended in the book there. So you're getting basically the gist of it. This book is written for laymen. It's informative, it's entertaining at the same time. And so if you have a person or loved one battling with Alzheimer's, this is a must-read. And I would recommend also the sequel to the book called The Alzheimer's Program. The reason being, this book gives you the evidence to convince you that the program works. It gives you the studies to back that up. But trying to follow the protocol from this book is a bit tedious. I had to make a Excel spreadsheet with picking out things here and there in this book to put together the program. Since then, they've come out with a book that is more user-friendly, and it just gives you the program, what to do in a simple, logical format without as much of the scientific backing, but just helping you implement the program. That's called The End of Alzheimer's Program. That's the second book. And if you're just wanting to implement it, that's the book to get. So remember, in Alzheimer's, there is amyloid plaque formed which blocks transmission of nerve signals. So the question is, well, why is amyloid formed in the first place if it's harmful? Well, what happens is the brain suffers some form of injury or an infection or another assault and responds by defending itself. The defense mechanism includes producing Alzheimer-associated amyloid plaque. It's like you get pneumonia, your body releases white cells to attack the bacteria. In the brain produces amyloid plaque to protect itself against infections and toxins and decreased in supportive chemicals. And that's why preventing amyloid plaque from forming or destroying it once it's formed has not been helpful, because it actually has a beneficial effect in addressing these attacks on the brain. So, Alzheimer's disease and the formation of the plaque is actually a protective response to different threats. Type 1 threat is chronic inflammation. Inflammation actually increases the formation of amyloid from amyloid precursors. So amyloid formation is part of the inflammatory process in the brain, as it helps fight invaders like infections and toxins. It's kind of like what white cells do in the peripheral circulation. That's inflammation. Type 2 threat are suboptimal levels of nutrients and other synapse-supporting molecules. There's not enough nutrients to support the 500 trillion nerve connection. So the brain says, okay, we don't have enough support to support all these connections. We need to downsize. So the amyloid plaque is formed and actually sends out signals to the brain, get smaller, downsize. We can't support the whole brain. And so if you don't have enough B12, vitamin D, or the hormones we'll talk about shortly, your body will downsize because that's all it can support. Type 1.5 is called, it's called type 1.5 because it's a combination of type 1 and type 2. This is insulin resistance. This insulin resistance is the same insulin resistance that causes diabetes type 2. It's also, I can show evidence that it's also the reason for our obesity epidemic in America, insulin resistance, as well as essential hypertension, which you have in America. That's a whole different set of series. We show how insulin resistance causes diabetes type 2, how it causes hypertension, and how it causes obesity. Now we're finding that it also can cause Alzheimer's, and it's probably in America the most common cause of Alzheimer's that we see. Why is it a combination of inflammation and nutrient deficiencies? Well, it's because when you have insulin resistance, that insulin resistance allows sugars to be very high. Those sugars combine with proteins in the body, like hemoglobin, giving you hemoglobin A1C, but other proteins. And when the proteins are combined with sugar, the body doesn't recognize them anymore. It thinks it's a foreign protein, and so it attacks it, and it attacks it with the inflammatory response. It says, I don't recognize these proteins, and so you get inflammation. So type insulin resistance will cause inflammation through that mechanism, so it's partly type 1 effect. It also has decreased nutrient problem. With insulin resistance, insulin drives sugar into cells to be burned. When you are resistant to that effect, the brain is being starved of the sugar it needs to produce energy, and so you have a nutrient deficiency. No sugar going into the cells to produce energy. The third type is toxic exposures. If you are exposed to, say, mercury or lead or something of this nature, or iron, high levels of iron, the brain will form amyloid, which binds and surrounds the iron to protect it from oxidizing other molecules. It encases it. It's kind of like arresting it, putting it in jail. And that's why the amyloid plaque is formed in toxic situations. Type 4 is vascular problems, cardiovascular disease. If you don't have good circulation to the brain, your brain can downsize as well because you don't have enough support for it. And the fifth one is trauma. History of head trauma can increase the risk of Alzheimer's. This is a motor vehicle accident or football playing or any time you get continued trauma to the head. Now, the realization that Alzheimer's disease can exist in different subtypes, or a combination usually of these different subtypes, has profound implications on the way we treat it. We have to evaluate which of these mechanisms is at play in any given patient. And there are tests to help us identify which type you've got, and we're going to cover these a little bit later. So, if you have, this is how it works. If you have infection, the infection causes inflammation and the formation of amyloid as an inflammatory response. The amyloid plaque has antimicrobial effects. The amyloid plaque can actually attack bacteria, so it can be a helpful agent. It's part of your body's ability to fight infections. Now, let's say you have a low level of nutrients, for instance, maybe B12. The amyloid plaque is formed in this case, and it sends out signals to the brain to downsize. Basically says, we don't have enough B12 to go around, we're going to have to shrink the brain. And so the plaque responds to inadequate levels of hormones, that's like testosterone, estrogen, the sex hormones, thyroid hormones that regulate your metabolism, and other hormones in your body. It also responds if you don't have enough vitamins or other nutrients. And the other one, mercury, say, is a toxin. In response to this toxin, amyloid beta plaque is formed, which binds the toxic mercury, encases it, and prevents it from destroying any more of your brain. Amyloid can also bind excess copper and excess iron. So iron and copper are things you want to avoid excess amounts of. And a special case is diabetes. Again, we mentioned how diabetes can cause inflammation by putting sugar on proteins and getting an inflammation against the protein that has sugar on. These are called glycosylated proteins. And it will also cause low level of nutrients because the sugar can't get in the brain cells to be burned. And so the amyloid sends out signals to downsize the brain because it can't support the whole brain. As mentioned earlier, previous attempts at removing amyloid either produced no benefit or made the patients worse. Now we see why. Removing amyloid can stop its antimicrobial action. It can stop the orderly downsizing action in the brain. And it can stop the binding of toxins in the brain. And this is why blocking amyloid production or breaking it up, destroying it through drugs has not worked well. What we really need to do is get rid of the thing that's causing us to form amyloid plaque in the first place. And that's get rid of the chronic inflammation, if that's the problem. Get rid of insulin resistance, if that's the problem. Increase the nutrient levels, if that's the problem. Or get rid of the toxins, if that's the problem. So let's take a look at these different types of Alzheimer's. Inflammation. Now, there's a genetic predisposition to getting the inflammatory type of Alzheimer's. This is ApoE4 gene. You get one gene from your mother, one gene from your father. Normally, you get ApoE3. That's the normal gene. But if you get the ApoE4 gene, that's the one that causes more inflammation. It accelerates your inflammatory response. And that can be a good thing if you've got an infection. But if you have chronic, unrelenting inflammation, the beta amyloid plaques can increase in number and get out of control. Okay, so each person has two ApoE genes, one from mom, one from dad. 73% of Americans have two normal ApoE3 genes. It's the E3 that's normal, two of them. They have a 9% chance of getting Alzheimer's in their lifetime. About 25% of the population has one ApoE4 gene. That increases their risk of Alzheimer's to 30% risk in your lifetime. 2% of the population has two ApoE4 genes, and that increases your risk by 50%, or you have a 50% chance of getting Alzheimer's in your lifetime. But remember, as we talked about last night, eliminating the saturated and the trans fats can decrease your chance of getting Alzheimer's by 80%. That would mean that if I had two ApoE4 genes and I had a 50% chance of getting it, I could drop it to 10% just by eliminating the trans fats and the saturated fats. And that puts you at the normal risk of the rest of Americans that don't have either ApoE4 gene. Now, remember, Alzheimer's causes short-term memory deficit. Long-term memory usually stays intact till later, and the ability to calculate is usually lost later on. And my father's ability, he was getting Alzheimer's, and I shared this last night. He was in a rehab from a broken hip, but he had developed Alzheimer's, but he knew that he was 3 miles from home. He recognized the area, and they had all the doors locked, but they watched the front door to make sure people weren't wandering off and getting lost. So he went to one of the doors that was locked. He saw out the window that he was close to his home. He says, well, if I can just open this door, I can walk home. Well, I wouldn't have figured this out, but he knew how to open the door. He pulls the fire alarm, and all the doors opened, and he's out the door. So I said, now, I wouldn't have figured that out. So he might have had short-term memory deficit, but he was still able to calculate. He was a chemist for DuPont, so he was used to solving problems. How do you measure for inflammation? The CRP value. This is a blood test, and if it's elevated, you've generally have some inflammation. Doesn't tell you where the inflammation's coming from or why it's there, but it does tell you have inflammation. That's the most common test. There are other tests which really aren't used a lot. Albumin to globulin ratio. If this ratio decreases, that's a sign of inflammation. Interleukin-6 can be measured. That's another sign of inflammation. Tumor necrosis factor, that's another sign of inflammation. But again, we don't do those usually. We usually just check a CRP. level. And if you have insulin resistance, that may be from inflammation. But again, if you just get a CRP level, that's usually sufficient to tell you if you have inflammation or not. Okay, now the next type of Alzheimer's is lack of trophic support. It's called the cold type. It doesn't involve inflammation. It occurs more frequently in people who carry 1 or 2 copies of the ApoE4 gene, putting them at higher risk for Alzheimer's. Like the inflammatory type, it starts with a loss of short-term memory while retaining long-term memory. In type 2, there is no evidence of inflammation. The support for the brain synapses dries up. What is the support that's lacking? Usually there's a deficiency of one of the or more hormones, including the thyroid hormone, which regulates your metabolism, the adrenal hormones, which electrolyte imbalances, estrogens, progesterone, testosterone, pregnenolone. These are the sex hormones. And now, if you're measuring these hormone levels, you have to be careful between normal and optimal. You know, and I tell patients, say, hey, doctor says my cholesterol's normal. Well, that's not the same as optimal. Let me illustrate. In America, it's normal to die of a heart attack. Is that optimal? Well, no, okay. Most people do not have optimal blood levels. You want optimal hormone levels, not normal. Normal is a statistical term which tells you what most people have. Optimal is the level which helps prevent disease. When you get your lab printout, it's going to give you the normal range. And that's the range in which your value, if it's normal, falls within 2 standard deviations of the mean that the laboratory tests when they test everybody. So if you get Bredeson's book, he will give you optimal levels for those same blood tests, and that's what you want to shoot for. Vitamin D is often reduced. Insulin resistance may occur, or insulin levels may be too low. Homocysteine may be high, indicating a deficiency of folate or B12. This type responds more slowly to treatment than the inflammatory type. It takes longer to reverse. So let's look at an example taken from Bredeson's book. A 75-year-old psychiatrist developed severe difficulty remembering new information, which progressed over 2 years. She had no difficulty organizing or calculating, dressing or speaking. She underwent PET scan, which showed the typical findings for Alzheimer's disease. PET scan, again, you're tagging sugar, and when the brain is active, it's sucking up the sugar and burning it and doing its job. When the PET scan, the sugar that's tagged, if it's being taken up, it means that part of the brain is active. If a part of the brain isn't taking it up, it means that part of the brain is not active. And so they had decrease in the hippocampus area, which is typical of Alzheimer's. The hippocampal volume, the volume of the hippocampus, that's the organ that is reduced in size when you have Alzheimer's. That's the organ in the brain that is attacked. It was only the 16th percentile in size. In other words, 84% of patients had hippocampal sizes greater than hers. Her online cognitive assessment placed her in the 9th percentile for her age. In other words, 91% of the people taking the test scored better than she did. She also was ApoE4 negative. Her blood chemistry shows she had a reduction of vitamin D, pregnenolone, which is the precursor for the sex hormones. She was low in progesterone, low in estradiol, low in the thyroid hormone, low in B12, and they diagnosed her with type 2 mild cognitive impairment. This is the pre-Alzheimer's condition. Decrease in cognitive abilities, but not at the point of being diagnosed with Alzheimer's. She began the RECODE protocol, and over the ensuing 12 months, she noted marked improvement. Cognition assessment increased from 9% to the 97th percentile. In other words, only 3% of the population had scores higher than hers for her age. Her significant other said her memory went from disastrous to just plain lousy to like a steel trap. It was excellent. Her follow-up labs showed improvements in all those hormones that we discussed. Okay, so let's look at a special type of Alzheimer's, a combination of type 1 and 2. That's insulin resistance or diabetes, type 2. And we explained how in insulin resistance you get protein bound to sugar, which causes inflammation, and the sugar can't be taken up into the brain cells to be burned. So it's kind of like type 1 and type 2 put together. In both of those types, there is a downsizing signal sent to the brain, causing an orderly downsizing of the brain, resulting in more destruction than production of synapses. So the brain is actually shrinking and becoming less capable. Okay. And then type 3 Alzheimer's is toxic, and this usually occurs in people who do not have Alzheimer gene, ApoE4. It doesn't run in families because it's a result of toxins, not genetics. It usually starts in the 40s to early 50s. It usually follows a period of great stress. It doesn't start with memory loss, but instead with difficulties thinking involving numbers or speech or organizing. This type isn't a result of strategic downsizing of the brain. In other words, the brain orderly downsizing. It's more like the brain being destroyed by tossing a grenade in there. Everything is at risk. Things are being knocked out without any order to how the body's downsizing the brain. It has the poorest response to the original RECODE protocol, forcing the development of the current RECODE program. High blood levels of toxic chemicals such as mercury, cadmium, lead, or mycotoxins, which are produced by molds, can cause this type. Now, since mercury makes a beeline for tissues such as bone and brain, measuring its concentration in the blood isn't necessarily going to indicate its presence. You really need a chelating agent, something that'll pull it out of the tissues into the blood, and then you can take the blood test or the urine test and it'll show up. In other toxic forms, it's too much copper or too little zinc. Turns out the copper to zinc ratio is key. If you have a high copper to zinc ratio over I think it's around 1.2, if there's more copper than zinc, that can cause inflammation and that can cause Alzheimer's. And by the way, zinc is not usually one of those minerals that's tested in a standard blood test. So if you're getting screens for Alzheimer's, you really have to actually go a little bit beyond the normal blood tests that are requested. However, LabCorp and Quest will do the tests. It's just they're not in your standard complete metabolic profile that is normally ordered. Okay, what's an MRI look like? Well, the MRI, it's like a CAT scan. It just takes pictures of the brain. And if it affects, Alzheimer's affects many areas of the brain, not just the hippocampus. And the MRI will show multiple areas of the brain have shrunk in size. There also may be multiple hormonal abnormalities on the blood test. They will show neuroinflammation with vascular leaks as shown on the MRI, in which there are multiple abnormal small white spots on the MRI. So generally, if you get the MRI, the radiologist will interpret it and say, yeah, this MRI is consistent with Alzheimer's. That means he's saying it looks like Alzheimer's. So they will give you that tip-off. In type 3, they're usually diagnosed with another type of dementia until the abnormal PET scans or spinal fluid show that they do have a form of Alzheimer's. Carl is another example Bredesen gives. Carl, 55 years old, had toxic Alzheimer's. This is his story. He had cognitive complaints for a year, and they were getting worse. A numbers whiz kid his whole life, he now struggled to balance his checkbook. He had been a superb professional poker player, but now he couldn't remember the cards. He often used the wrong word or a different word from that which he wished to use and found himself calling a person by the wrong name. He also had difficulty paying attention. Watching a basketball game, he would forget which team had the ball. His thoughts sometimes raced. He had bouts of mild depression. He had no family history of Alzheimer's. A PET scan revealed a typical pattern of Alzheimer's disease, though mild at this stage. He was diagnosed with mild cognitive impairment, a precursor to Alzheimer's disease. No further evaluation or treatment was suggested other than the annual follow-up. And that's kind of the scary thing. You can have pre-Alzheimer's, and since mainline medicine really doesn't know what to do with it to prevent it, I'll just say, well, we'll just watch it till it gets really bad, and then we can put you on one of these drugs to suppress the symptoms. But if you catch it earlier, of course, you got a better chance of making a dent and reversing it. He was later found to be ApoE4 negative. When Carl contacted Dr. Bredesen, he suggested he undergo testing for heavy metals, mercury, and for mycotoxins, toxins that are produced by molds. Myco meaning fungus or mold. These are aflatoxins, orotoxins, gliotoxins, triothesines. The lab found that Carl's mercury level was one of the highest they had recorded in years. Carl responded well to the treatment for his mercury toxicity. They do chelating agents to pull the mercury out of his system and excrete it in the urine. Not only did his overall cognition improve, so did his poker, now which may or may not have been a good thing depending on your spiritual orientation. So anyway, he was thinking better now. So, for preventing Alzheimer's, well, as we move toward treating Alzheimer's, we don't want to forget the things used to prevent Alzheimer's because those need to be in place. A quick review of what we covered last night. These recommendations work for all 4 types of Alzheimer's. You want to avoid the saturated fats, that's the meat and the dairy. You want to avoid the trans fats, that's the processed foods and fried fast foods. You want to eat the polyunsaturated or plant fats. Avoid the iron and copper in the vitamins and supplements. Get antioxidants like vitamin E from the nuts and seeds. You can get glutathione in olives. We had some olives today at lunch. Vitamin C is a good antioxidant at physiologic levels. Get anthocyanin from the colored fruits, grapes, blueberries, etc. And get exercise. Work up to 40 minutes of a brisk walk 3 times a week. Mental exercises, 10 minutes a day, 5 days a week are helpful. Professor Mike Merzenich won the prestigious Kavli Prize for Neuroscience in the area of neuroplasticity. He developed Brain HQ, and it has documented success. For instance, one of the games in the program, a speed processing training program, Double Decision, reduced the risk of dementia by 50% 10 years after the training. So brain exercises help. Sleep, we talked about, 7 to 8 hours of sleep per night, important. In order to do this, keep the room dark, quiet, wind down prior to sleep. The hours before midnight are twice as restful as the hours after midnight. So if you want to sleep 8 hours, if you go from 9 to 5, that's much more beneficial than going from 12 to 8, even though both are 8 hours of sleep. But in the first set, you're getting 3 hours of sleep before midnight. That's the most important part for rejuvenating your system. Avoid exercise a few hours before sleep, exercise earlier in the day, avoid blue light at night. Blue light can actually be from your computer, and actually the Apple computers, in the system settings, you can actually set your screen to go from blue light to warmer colors away from the blue light, and it says down there, do this in order to get more restful sleep at night. So they're even aware of that computer screens can make it harder to sleep. Avoid stimulants, keep hydrated. Keeping hydrated will help with sleep and your function in general. How do you know if I'm dehydrated? Thirst mechanism may not be as helpful as it was in younger days. As we get older, thirst mechanism doesn't seem to be as reliable to tell us we're dehydrated. The best way to know is when you're urinating in the toilet, look at the urine. If it's dark, concentrated yellow, it means you're not getting enough fluid, water. If you should drink enough water to where it's just lightly tinged yellow and doesn't have a strong odor, then it's diluted, and that means you're getting enough water. And again, trust in God. That helps you avoid stress, which decreases your cortisol level, which helps protect your brain, because cortisol can be toxic to the brain. So those are the general measures. Now we want to identify some specific measures for different types of Alzheimer's. And these can be from inflammation, low levels of hormones and other nutrients, exposure to toxic substances. Those which have cognitive symptoms, when you measure these levels in the blood, they may have 10 to 25 abnormal lab values. But if they're only at risk or have just mild cognitive impairment, they may only have 3 to 5 abnormal blood tests. So let's look at how to diagnose a few specific types of Alzheimer's and what to do about them. One of the most common causes of Alzheimer's is insulin resistance. What's happening in insulin resistance? Okay, so this is the most important one. What is insulin resistance? And to understand how insulin works and why treating insulin resistance is so important, let's see what a healthy system does with insulin. When we eat a vegan diet, that's usually 80% carbohydrates. That's either starch or sugar. 10% fats, 10% protein. And the sugar in the blood rises. When the blood sugar rises, it's a good time for the body to start burning sugar and save the fat for later. Does that make sense? You've got high sugar levels. Let's burn sugar. Let's save the fat for later. It's a good storage for energy for later. So in the setting of high blood sugars, how does the body shift to burning sugar and away from burning fat? Well, that's where insulin comes in. The pancreas releases insulin to shift the body from fat burning to carbohydrate burning. And So when the pancreas senses sugar is high, it releases insulin, tells the body to burn sugar instead of fat. Also, some of the sugar is burned immediately. Some of it is stored as a starch called glycogen in the liver and in the muscles for later use. That's a good thing to do, save it for later. And some of it is turned to fat and stored in the fat cells to be used later. And also, insulin acts to prevent fat from being burned. It says, let's not burn the fat now, let's save it for when the sugar levels are low, and we need it. That's a good design, right? The body is being economic. It's saving the fat for later. Okay, now, several hours after a meal, the blood sugars are now dropping. At this point, now the body wants to shift from burning sugar, because there's not much in the blood anymore, to burning fat. We're going to burn the fat stores that we stored after the meal. So, how does the body make that shift? Well, with lower blood sugars, the pancreas releases less insulin. This tells the cells to shift away from burning sugar, and instead let's burn fat. Burning fat produces ketones and mild ketosis, which is okay. That's all right between meals. It also tells the liver, it says, liver, my blood sugars are starting to drop too low. Can you turn some of that starch you saved after the meal back into sugar and release it into the bloodstream? And so that's what the liver does when the insulin levels are low. It turns the starch glycogen back into sugar. It also turns down the sugar burners, so you're burning sugar less quickly. That keeps your blood sugars up where they should be. And important, this is the phase when you're in the fat burning mode. This is the phase or the period where the body cleans up the amyloid plaque in the brain. And so you need these periods of low insulin levels to clear up the plaque. This is the time when that happens. So, what happens in insulin resistance? When we eat oxidized fat, and I'll explain what this means shortly. When we eat oxidized fat, like olive oil that's been taken away from its antioxidants in the olive and exposed to air, that olive oil plugs up the insulin receptors, and it makes the cells resistant to some of the effects of insulin. The main effect that is affected is it prevents the insulin from bringing sugar into the cell to be burned. So with insulin resistance, the sugar can't get in the cell to be burned, and it stays in the blood, and that's why you end up getting high blood sugars. That's insulin resistance. And that's the chief effect. Well, when the blood sugars start to rise, as we see here, what does the pancreas do? How does the pancreas respond? Well, it panics. It says, I've released insulin, but it's not enough. The blood sugars are rising, and it releases more insulin. So the insulin levels rise. You say, okay, so what? Okay, the so what is that insulin also causes excess sugar to be stored as fat. So when you have insulin resistance, your insulin levels are going to go high. What's going to happen to your body weight? It's going to go up, because that's what insulin does. It drives fat into the fat cells to be stored. It also turns off the fat burners so that you don't burn your fat, you're saving it for later. That's what the higher insulin levels do. That's why insulin resistance causes obesity, and it causes, well, it's how it works. The other thing, once the insulin level is high, remember the way to turn to the fat-burning mode is to get low insulin levels. That doesn't happen now. You're no longer going into those fat-burning modes with these high insulin levels, which means there's no plaque cleanup, because it's in this fat-burning mode, that's when the amyloid gets cleaned up, and you're preventing that from happening with these high insulin levels. So there's another problem with insulin resistance. That high insulin level, when insulin is high, the body has an insulin-degrading enzyme. It's called IDE. This insulin-degrading enzyme breaks down insulin to bring it down to normal again. So there's a normal balance between the pancreas producing insulin and the IDE destroying insulin. Well, when you have high insulin levels, the IDE is busy degrading the insulin. The other job that IDE is it cleans up amyloid plaque. It gets rid of the plaque. So if you have high insulin levels, the IDE is busy degrading the insulin, and it doesn't have any time to degrade the amyloid plaque. And so you're losing out on the IDE's cleanup procedure when you have high insulin levels. So, how do I know if I have insulin resistance? Well, that should say insulin resistance. If my A1C is over 5.5, you've got insulin resistance. In other words, the insulin resistance is high, so the pancreas is producing more insulin, and the sugars are high. That sugar binds to hemoglobin, and that produces hemoglobin A1C. And if the percent of hemoglobin molecules that are bound to sugar is 5.5 or more, it means you've got insulin resistance. This A1C is a measure of the last 3 months of your blood sugars, because that's how long a red blood cell lives, it's 3 months. So this gives you an idea of if you have insulin resistance. The other one is a fasting blood sugar over 90. Now, again, normal values, they say you want to keep it under 100, but optimal is less than 90. And then the most important one is the most sensitive one is your fasting insulin levels. Fasting insulin should be less than 5.5. If it's more than 5.5, you've got insulin resistance, and your pancreas is pumping out more insulin to overcome that resistance. So you want to get your fasting blood sugars down below 5.5. And we have people, they come to Heartland, we get their blood tests on everybody that comes, and I mean, it's typically 10, 20, 30, we've had some 40 or 50. I mean, the insulin level is extremely high, and when they come through the program and they give up the meat, the dairy, and the free oils, the salad oils, cooking oils, fried foods, insulin levels drop dramatically and the weight starts coming off without calorie restriction or even without exercise. Okay, so how do I get my insulin and my blood sugars low? Because we want to get those insulin levels low at least for many hours during the day to allow the body to be in the fat-burning mode, because that's where the amyloid plaque is burned up, cleaned up. We recommend a 12-hour fast nightly. This induces a mild ketosis. This extends the time that we are in the fat-burning mode. So the time between the last meal, when you finish the last meal at night, and you start the first meal of the next day, should be at least 12 hours. It's recommended that if you have the ApoE4 gene, you extend that to 14 to 16 hours of fasting between your last meal of the day and your first meal the next morning. That will allow your plaques to be cleaned up. Now, by the way, it puts you in mild ketosis. Ketosis is when you're in the fat-burning mode, you'll produce ketones. That's a normal response. Low levels of ketones are okay. But ketoacidosis, this is where if you go to extreme values, it can be lethal. In patients with type 1 diabetes where they're not producing any insulin, when the insulin levels are so low, you go into the fat burning mode completely because you can't burn sugar. And you produce ketones, and lactic acid builds up, and you get very acidotic and can be lethal. So you want to avoid that. But for normal people without type 1 diabetes, you're not going to get ketoacidosis. Okay, so to test if you have, if you're getting into keto, to test your ketones, because you want to get mild ketosis, they actually have meters, and you can test your blood in the morning and see if you're in mild ketosis. You can get the meter. It's a meter. The meter will tell you both blood sugar levels and ketone levels. And Bredeson's book explains how to do that in more detail. Okay, there we go. The other way to keep insulin levels low on a high-carb diet is eat carbs with low glycemic index. Legumes are one of the best sources of low glycemic index foods. They enter the intestines, and they're as a starch. The enzymes you have to break down that starch chain starts from one end, breaks off one sugar, throws it into the blood, breaks down the next sugar, throws it in the blood. This takes about 4 or 5 hours. So over those 4 or 5 hours, you have a steady infusion of sugar into your bloodstream, and you won't get hungry for 4 or 5 hours. I mean, I thought, wow, is that real? And I found that's really true. If you eat a large bowl of beans or legumes, we had lentils today, we had beans today for lunch, those will stick with you and keep you from getting hungry for 4 or 5 hours. It works very well. And it prevents the sugar spike. If you take, here's a list of low glycemic index foods: the beans, seeds, walnuts, intact grains, vegetables, sweet fruits. If you eat the fruits themselves whole, that's good. Mushrooms. No. One thing to note about grains, in Bredeson's protocol, they recommend going gluten-free because of the high risk of people being sensitive to gluten and causing inflammation. Gluten is in the wheat, rye, and the barley, so that's a good thing to avoid, at least initially. If you are sensitive to grains or to foods, it's a good idea to do an elimination diet. How do I know if I'm sensitive to foods? Well, it can be manifested by a rash, acne, arthritis, widespread body pain, headaches, fatigue, mood swings, and irritability and brain fog. If you have those symptoms, you can do an elimination diet where you eliminate the grains, corn, soy, and nightshades, and then reintroduce them slowly on day 1 and 2, you introduce the new food and see if you have symptoms. Then on day 3, no new food. Then on day 4, you introduce another new food and see if you get symptoms from it. Avoid insulin spikes. These occur with high glycemic index foods. These are like sugars, breads, grains, white breads, especially white potatoes, white rice, soft drinks, alcohol, candy, cakes, processed foods. These will give you a sugar spike with an insulin spike, and those insulin spikes can again prevent you from going into the ketosis. Also recommended, don't eat anything 3 hours before bedtime. This prevents the sugar load and the high blood sugars and high insulin levels during the night. That's the best time to go into ketosis. As we've seen, this allows fat burning at night and allows your body to clean up the amyloid plaque in your brain. Exercise 40 minutes 3 times a week. Work up to that if needed. If you remember, this reversed the normal shrinkage of the hippocampus in elderly people. It actually, instead of decreasing it at 1.4% per year, it actually increased it by 2% in a year's time. It reversed the shrinkage. Eliminate insulin resistance. And this is probably the most, if you don't remember anything else, if you can remember this thing, it's probably the most important thing for preventing and reversing Alzheimer's. You want to avoid meat, dairy, and free oils. And with Adventists, usually I don't have a problem with the meat and the dairy. You want to get to the free oils. That's what they say, well, what's wrong with free oils? Why is that a problem? Dr. Vogel, cardiologist, University of Maryland in Baltimore, did a study which showed the problems with olive oil. It turns out that insulin dilates blood vessels. If you have insulin resistance, which can occur in a few hours, it prevents the arteries from dilating. So what he did was he took medical students, put a blood pressure cuff on their arm, shut off the blood supply to the arm for 5 minutes. Then he released the cuff, and the arteries dilated. He measured that with a Doppler ultrasound. The arteries dilated to restore blood flow to an ischemic hand, a hand that didn't have any blood flow. So he said, okay, that's a normal response. No insulin resistance there. The next day, he fed him 50 grams of animal fat, and when he released the cuff, the arteries didn't dilate. He said, oh, the animal fat caused insulin resistance. That was not unexpected. He said, well, that was an unhealthy fat. So the next day, he said, I'm going to use a healthy fat. Let's use extra virgin olive oil. So he gave him the extra virgin olive oil, 50 grams, released the cuff. The arteries didn't dilate. He said, oh, no, I thought olive oil was healthy. He thought about it, and he said, well, maybe it's oxidized olive oil. That's the problem. So the next day, he gave him 6 capsules of antioxidants. Then he gave him 50 grams of olive oil, and then when he released the cuff, the arteries dilated. The antioxidants apparently took that oxidized olive oil that they were drinking and reduced it back to its unoxidized state so that it didn't cause the insulin resistance. So it appears that oxidized oils are the problem. Where do you get an oxidized oil? Well, if you expose any oil to air, it's going to get oxidized. If I take an avocado and mash it up, make guacamole, and set it on a shelf, what's going to happen to it? It's going to turn brown. Yeah, how long does that take? A few hours. Doesn't take long. Yeah, it's getting oxidized. So if you like the fats, which is okay, you just want to get it in the unoxidized state. So the next question is, did God put antioxidants in olives to protect the olive oil from being oxidized? So to find out, researchers went to an olive press where they were making olive oil, and they said, the guys there said, oh, you want some olive oil? I said, no, we want your pulp, the stuff you're throwing away. They said, yeah, help yourself. So they took the olive pulp, they tested it for our body's main antioxidant, which is glutathione, and they found large amounts of glutathione in the pulp that was getting thrown away. And when they fed the pulp to volunteers, their glutathione level rose dramatically. So the antioxidants that God put in the olive protect the olive oil from being oxidized, and it's healthy. But if you press the oil, take it away from the antioxidants, expose it to air, it gets oxidized, and it's a problem. That's why Ellen White, she wrote, When properly prepared, olives, like nuts, supply the place of butter and flesh meats. The oil as eaten in the olive is far preferable to animal oil or fat. And when I first read that, I thought, why does she say the oil in the olive? Why doesn't she just say olive oil? But she didn't, and now we understand why. Because when you eat the oil when it's in the olive, it's protected by the glutathione in the olive, and it's protected by a skin. It's unoxidized. When you take it out, it gets oxidized. Unfortunately, the people that published the Ministry of Healing put a little footnote on that, and at the bottom it says, see, Ellen White endorsed olive oil. I said, that's not what she said. And so you got to understand why she said it the way she said it. So, at any rate, we've got nothing against the healthy fats in their unoxidized state. You just want to get the avocado oil in the avocado or in the olive or in the seeds or in the nuts. Even if you make nut butters, the oil separates out, gets exposed to air, and gets oxidized. If you buy the peanut butter, the real stuff, it's got a layer of oil on top. You have to mix it up. Well, it's got oxidized. So if you really want, nut butters, the best thing is to mix it up fresh, like you do with guacamole. You mix it up fresh. You make the peanut butter fresh, and that's a lot of work, and so most people probably won't do that. But if you're fighting Alzheimer's or fighting diabetes type 2, that would be another step to take to help reverse it. When we talk about diabetes, we go into that in a lot more detail. These are the foods to avoid: the meat, the dairy, and the free oils. And here's Ellen White's quote says, when properly prepared, olives, like nuts, supply the place of butter and flesh meats. The oil as eaten in the olive is far preferable to animal oil or fat. Problems with meat. In his original book, Bredesen allowed meat as a condiment, as a concession, but not as a recommendation. And why? Well, as we mentioned, animal products are much higher in saturated fats than the plant fats, than the plants that don't have the saturated fats as much. Also, the average polyunsaturated saturated fat ratio for plants, which is protective, is of the order of 10 times higher in nuts, seeds, and legumes than in meat products, and about 100 times higher than for dairy products. So it recommends a largely plant-based diet, and we recommend a total plant-based diet. And animal protein in the China study did promote cancer in rats exposed to aflatoxins. We also know a high animal protein diet causes osteoporosis, and that's a whole different topic, but it does. Meat and free oils cause insulin resistance, we just covered, and meat can cause coronary artery disease, and a vegan diet was used to actually reverse heart disease, opens up arteries. Good fats are okay: avocados, nuts, seeds, olives, and avoid the free oils. So you can eat the avocados, nuts, seeds, and olives. Further help for insulin resistance. These are some supplements that can help with insulin resistance. Normally, 9 out of 10 patients that come through Heartland, insulin levels drop. Occasionally, we see one that doesn't. If that's the case, we can add zinc. Zinc picolinate is helpful. Cinnamon, we've seen good response to cinnamon, 1/4 teaspoon a day. Alpha-lipoic acid is an antioxidant. That has been helpful. Chromium picolinate and berberine have also been used for insulin resistance. I might add, if you do get Bredesen's book, he's not aware that the oxidized the oxidized oils can cause insulin resistance. And so the only way he knows to get the insulin levels down is to avoid the sugar spikes or the starches. But he does say, if whatever means you do get the insulin levels down, meaning you're insulin sensitive, then you can include the grains and the fruits and those types of things. I'm just sharing with you an extra modality that you can use to get the insulin levels down so that his cautions against the grains, you don't have to observe those cautions if you can get your insulin levels down with the means I've just shared with you. So to review, 12-hour nightly fast, and if you have ApoE4 genes, you want to get 14 to 16 night fast. Eat carbs with a low glycemic index. Don't eat 3 hours before bedtime. Exercise 40 minutes 3 times a week. Lower your insulin resistance by eliminating meat, dairy, and free oils. And how do I know when it's gone? If your A1C is less than 5.5, fasting blood sugar below 90. But the most important one, the most sensitive one, is get a fasting insulin level. These are not expensive tests. I don't know, $20 for a fasting insulin level, and it should be below 5. Another type of type 1 diabetes, another type of Alzheimer's is type 1. This is caused by inflammation. How do I know if I have inflammation? Your CRP level will be high. There are ways to reduce inflammation. Omega-3 fatty acids can lower inflammation. Omega-6 fatty acids increase it. So if you get the ratio of those two, you want a very low omega-3 compared to your omega-6 ratio. And they have shown that these can be helpful in reducing inflammation. The sources are fresh ground flaxseed, Persian walnuts, those are pecans, Persian walnuts, those are English walnuts, pecans, and hazelnuts. And people say, well, can I just use fish oil? Fish oil has become a multi-million, maybe multi-billion-dollar industry. This was actually, the benefit of fish oil was debunked by an article by Dr. Michael Greger in his book, How Not to Die. He cites a JAMA review of the randomized clinical trials evaluating the effect of fish oils, omega-3, and showed no effect on lifespan, cardiac death or sudden death. You say, well, where did we get this idea that fish oil was healthy? Well, the DART trial in the 1980s involving 2,000 men found that those that were advised to eat fatty fish had a 29% reduction in mortality. That's the article that got publicized and advertised. The DART-2 trial was done by the same researchers. In that trial, they did not 2,000 men, 3,000 men, and they not only advised them to eat oily fish, they gave them fish oil capsules. And those that got the fish oil capsules instead of the placebo had a higher risk of cardiac death. Since then, they've done randomized clinical trials, and they showed that the omega-3 in the fish oils did not prolong life, did not prevent cardiac death or sudden death or heart attacks or strokes. And because of that, I think Mount Sinai Hospital in New York, cardiology department says we can no longer, or we can't recommend fish oil to prevent against heart attacks and strokes. Okay, so those are the best sources. Okay, a common cause of inflammation is gluten sensitivity. It's rampant now and it can cause inflammation, which can promote Alzheimer's. There are many gluten-free grains, including rice, quinoa, chia, millet, and gluten-free oats. You say, well, aren't oats gluten-free? Well, the issue is sometimes oats are processed in a place where they process wheat, and so they're worried that some of the wheat content can get into the oats, and so they can advertise gluten-free oats if they're made in a place that doesn't process gluten. remember the grains that do have gluten is wheat, rye, and barley. So you'd want to avoid those. Another cause of inflammation is chronic infection. You want to treat any nose, throat, or sinus chronic infection. You may need to see an ear, nose, and throat specialist for that. By age 50 also, half the American population is not producing hydrochloric acid in the stomach, and they can't digest the protein adequately. And they may not have enough enzymes, lipase and amylase. So if the protein is not broken down into its amino acid components, it will stay as a whole protein. And if it gets absorbed as a whole protein, the body's immune system may react to it and cause inflammation. So if you're over 50, you may benefit, and if you have allergies, you may benefit from getting betaine hydrochloric acid, or there are even vegetarian hydrochloric acid pills with digestive enzymes you take with a meal to help digest the proteins so that it doesn't get absorbed whole and cause an allergic reaction. Probiotics can also be helpful. Another cause of inflammation is genetic, and you want to get an ApoE4 gene test. It's a blood test. Of course, we can't change that, but if you do have it, it's just a signal that you've got to be more aggressive on this protocol than, say, someone that doesn't have the ApoE4 gene. Type 2 Alzheimer's, we'll look at that. That's a lack of supportive vitamins and hormones. You have to get blood tests to determine if these are present. Here's a list of, I won't go through all of these, but these are a list of the typical vitamins that you can, these are supplements that are recommended unless your lab values say that you're in the optimal range. Go to his website and you can find the optimal range. And if you're not in the optimal range, you can take these supplements. These are supplements also that help. Nicotinamide is advised for everybody. And these are supplements that have different benefits for all types of Alzheimer's, but particularly with nutrient deficiencies. Also, besides nutrients, you want to have optimal hormone levels. Particularly important is thyroid hormone. That regulates how fast you burn calories. That's your metabolic rate. You need thyroid to increase your metabolic rate to optimal levels. Estradiol and progesterone for women, it's important to have healthy levels of those. Women, well, testosterone and adrenal function are also important to measure. And what about estradiol? Well, this is a challenge. Estradiol, estrogen, and progesterone can be used to help. They're important for brain function, actually. The problem is if you use estrogen alone, it can cause breast cancer or uterine cancers. You need to use it with progesterone. And generally, if you're using those, you should get bioidentical hormones. If you're going to use those, work with a gynecologist or someone who can prescribe those for you. And you'd also want to get probably get a mammogram or a breast exam to make sure you don't have breast cancer to begin with, if you're going to go this route. The estrogens that caused increased risk of breast cancer and uterine cancer were horse estrogens. And so they weren't bioidentical hormones, so there's controversy as to whether bioidentical hormones would be a problem or not. But in general, we talked to an obstetrician, came out to Guam at our clinic there, and all postmenopausal women, if they don't have a history of breast cancer and they have a normal mammogram, he starts them on estrogen replacements if they opt for that. You don't actually have to get a prescription for estrogen. You can get the precursor to the sex hormones, pregnenolone and dihydrotestosterone, online. Here's cholesterol. Now notice, do you need cholesterol to make all these hormones? Estrogen gets turned into pregnenolone, which then goes to dehydroepiandrosterone, and these get changed to testosterone, and in a woman gets changed to estradiol. So you don't actually have to take estrogens to get your estrogen level up. You can actually buy these two, pregnenolone or dihydroandrosterone, and that will increase the amount of estradiol you make, and you'd want to follow up with your estradiol levels to see if they're in the therapeutic range. And lastly, Alzheimer's can be caused by toxins. Toxins can be, you can reduce your toxins by detoxifying plants. These are plants that can bind and eliminate toxins from our bodies via the urine, the sweat, or the stool. And that includes cilantro, cruciferous vegetables, cauliflower, broccoli, cabbage, kale, radishes, Brussels sprouts, turnips, watercress, kohlrabi, rutabaga, arugula, horseradish, mama, and the list goes on. These can help lower toxins. The toxins you should specifically be checked for, particularly, are the mercury levels. Check for copper to zinc ratio. The ratio should be 1. It should not be elevated above, say, 1.2. Zinc picolinate can be used if your zinc level is low. Alpha lipoic acid can increase your antioxidant level to help prevent these from oxidizing. Other ways of getting rid of those, B6, manganese, stress reduction, avoid vitamins with high copper intakes. And chelation can be used. Quicksilver, there's some detoxification chelation protocols that can be used to help get rid of those metals. So what we've looked at diagnosing Alzheimer's, identifying what type of Alzheimer's is present, removing that particular disturbance, and we close with the herbs that can help remove plaque and rebuild synapses. These are some of the herbs that are recommended for everybody with Alzheimer's, and these are the general measures that we've discussed. I've kind of gone through these fairly quickly because if you want more details, you want a reference book, it's just simple. Just order his book online, and it's got the information in it that you can refer to. I just wanted basically to get you a general feel for Alzheimer's, and then how to use the book for reference. If you live outside of Maryland, you can usually order the tests that he recommends in the books online. You don't even need a doctor's prescription for that. I think in Maryland those are illegal. You can't do that, but there might be ways around it. Or you can just see your doctor, say, hey, I want these lab tests ordered. They can run, if you get all the tests that are recommended, it can run up to $1,500. Insurance probably won't cover most of them. So it can be an expensive venture. However, if you are fighting Alzheimer's, it's a lot cheaper than, 24-hour hospital care or nursing care for the rest of your life. I mean, it's worth it if you've been diagnosed with Alzheimer's to get the test and then take the measures to help reverse it. That's it. We went kind of quickly over a lot of material.
Thank you so much, Dr. Emerson.
My pleasure.
That was super informative. And do you have any questions? Would you like to ask anything?
I don't know how to start. So most you covered is for most people very helpful.
Most what?
What you covered is helpful. Food, exercise, and sleep habits, mind. But my question and my concern is about people, menopausal people, both men and women. More women than men is more obvious, especially because their hormone levels are often decreased, and then it's very hard to get it up, even with all the suggestions, and especially when the oncologists say you can't have it. But also with the hormone level decrease, you see often a rise in cortisol. So, do you have any ideas about that?
Yeah, you'd want to, two things. You'd want to, check, make sure you don't have, breast cancer, get a mammogram as baseline.
Yeah. So, sorry to interrupt. So, let's say you are diagnosed with this, for example, breast cancer. That's obvious, and it's positive with
estrogen
hormones.
receptor positive.
Yes. So, a lot of the herbs and supplements are oncologists. It interferes with the medication, because the medication would like to keep all these hormones down, but that's influence not only the quality of life, but then in the longer term, the chance of Alzheimer. And that's also a large group of people who have these concerns. So,
yeah, I recommend, if you've got estrogen receptor positive breast cancer, not to take estrogen replacement. No. Yeah, and in fact, you'd probably want to take things to lower your estrogen levels. Yeah, that becomes more of a concern than preventing Alzheimer's. Yeah. On the other hand, if that's not an issue, and you have a normal mammograms, and you're at risk for Alzheimer's, then the benefit of the estrogen replacement would probably outweigh the risk of, breast cancer, uterine cancers. By the way, in America, the reason we have at least I believe one of the reasons we have such a high rate of breast cancers in America is super high estrogen levels. 40 years ago, the women in America had 50% higher levels of estrogen compared to women in China. And because of that, women in America, they would have menses at about 12 and they'd end in around 50s. In China, it would start at age 18 and end in their 40s. And so what's the difference? Well, the difference was the fat content in their diet. It turns out that the way you get rid of estrogen is your ovaries and your adrenal glands make estrogen. It passes through the liver. The liver takes the estrogen and binds it to glutathione and puts it out in the bile. And then it goes the intestinal tract, and normally estrogen would get reabsorbed. But to prevent that, the liver binds the estrogen to glutathione, carries it out in the stool, and it can't be reabsorbed in the intestines because it's too big now. It's combined with the glutathione. And it gets carried out in the stool, and that keeps the estrogen levels low. But if we have a high-fat diet, animal fats particularly, that breeds a bacteria that debinds the glutathione from the estrogen, allows it to get reabsorbed, and that increases the estrogen levels dramatically. And that's why women, again, menarche at 12, menopause at 50 in America, but in China it was 18 and 40s. Now, in China today, it's probably not that anymore. They've adopted our lifestyle. We've just talked to a lady coming through Heartland because of endometriosis, and originally said, well, we can't, I don't know that we can treat endometriosis with diet. And then we looked up some work done by Neil Barnard and some other studies they've done, and they have successfully treated endometriosis. Endometriosis is where the estrogen levels are high, and the endometrium, the inside of the uterus, goes up the fallopian tubes out in the intestines and causes release of prostaglandins. And these prostaglandins cause cramping. And with high estrogen levels, it causes more severe cramping. I think, why would it cause cramping? Well, actually, it's designed to do that because when you have menses, you're bleeding, and the cramping from the prostaglandins causes constriction of the blood vessels to prevent from bleeding to death. And so that's a good thing in a normal level. But when you have high estrogen levels, it's too much, it causes cramping. So they just basically put them on a low-fat diet with eliminating the meat products, the dairy, and the oils. And usually by 1 month or 2 months, certainly by month 3, the cramping is gone, the symptoms go away. And when they did the tests, they found that the endometriosis resolved. So she's coming through the program. We're going to see how she does on that. But yeah, you're going to get benefits and risks. And lastly, the thing is, well, yeah, so you'd want to make sure you don't have estrogen-positive breast cancer to begin with, and then look at your risk of Alzheimer's and weigh the risk of breast cancer versus the risk of, Alzheimer's. Good questions.
And I'm also curious about what you talked about, the case 0, the woman. Did they follow up her because they were able to reverse her early or her pre-signs of Alzheimer's disease? Did they follow up with her? And does she still live?
Yeah, 8 years later, she was still negative. 2017 was when the book was published. And by that time, she was still doing fine. And then this recent follow-up book made a reference to it, so she's still doing okay. We find the biggest challenge, we find the same thing with diabetes type 2. People do great if they stay in the program, but as soon as they get off the program, symptoms come back again. The biggest challenge is compliance, helping people stay on the program. And for that, you really need, we had a whole study on, or we did a talk on how compliance doubled in staying on a healthy program if they had a morning devotional. If you have a 15-minute morning devotional, it doubled compliance. One study, the 4 diets they looked at, the Atkins, Weight Watchers, Zone, and Ornish's vegan diet, and they found that at 6 months, on a scale of 1 to 10, how well are you following the program? It was no better than 4 over 10. But the Daniel Cure was essentially a vegan diet plus a 15-minute devotional, and at 6 months, the compliance wasn't 4 over 10, it was 8 out of 10. It doubled the compliance by just having a morning devotional. So the biggest thing is helping people stick on the program. So when we do lifestyle programs, we tell the patients, we do spiritual devotions, not because we're trying to twist your arms to become a Christian or an Adventist or anything, but because it's going to help you stay on the program so you get better. And so we encourage that. So, yes, ma'am.
I have 2 questions for you. One is, what is the specific test done for the ApoE4 gene?
It's a blood test. You just ask for ApoE4 genetic testing. Your doctor can order. You can go to LabCorp and get it. I mean, if he writes a script, ApoE4 gene testing with blood tests, gives you the script, you take it to LabCorp, and LabCorp will try to bill your insurance, and if they won't pay for it, then you'll have to pay for it. Okay. But it's not, I don't think it's an expensive test.
Is it ordered by a neurologist or an internal medicine?
Internists can do it. I order them.
Okay.
Yeah, I'm in internal medicine, that's all.
And the second question is, I missed the name of the book that the physician that you have been referencing.
Yeah, it's called The End of Alzheimer's.
Okay.
And then the second book is The End of Alzheimer's Program. So that's it. Yeah, you're welcome. He's got questions too.
Thank you very much for this presentation. It's very, very useful. Quick question for you. I thought olive oils was supposed to be one of the good ones. I'm just curious, is there any cooking oil that is not oxidized, or should we even use cooking oil at all?
Yeah. The simplest answer is just find a different way to not use oil. That's the one I recommend. It's once you expose the oil to air, it's going to get oxidized, that I know of. There are simple fixes for bread. If they call for 1 tablespoon of oil, substitute 2 tablespoons of applesauce. It works. If you're frying foods, you can use water or steam things. Find alternative ways to cook without oil. It is a challenge. If you buy processed foods, just about all processed foods have oil in them. And I think it's a plot against us or something, because you look at some of the foods and you think, why do they add oil to this? It doesn't improve the taste any. It doesn't. But it's there. It's a challenge, but it is worth the effort if you're anxious. If you're fighting any of these challenges, Alzheimer's, diabetes, hypertension, obesity, heart disease, then you want to be more strict in following it. If your goal is to reverse these things. If you don't have these problems yet, then it may not be as much of a pressing issue. But ideally, that's the problem. Now, the other option is to, press your oil fresh. Get your own press and press it up before it oxidizes. Or Omega has it's a juicer, a horizontal juicer. It's like the old Champion juicers. And you can put it in an ice cream mode, and it will make peanut butter. You put peanuts in, and it'll generate peanut butter. You get a nut butter fresh before it oxidizes. How fast does oxidation have? I use the example of guacamole. You mix up the avocados. Within a few hours, it turns brown. Problem is with peanut, you don't see it change color. And so that's the bullseye. The closer you come, of course, to the bullseye, the better results you get. And how close you come, of course, that's a personal choice. We're not the food police, so we're not going to check up on you. Yes,
I guess it was a follow-up to his question, because I always thought that olive oil was really good, and that's what you keep hearing.
Yeah.
What do you say about coconut oil?
Coconut oil for Alzheimer's has been shown to they've had improvement in symptoms. It appears that the benefit may outweigh the risk with Alzheimer's. On the other hand, if it's an oxidized coconut oil, you will have probably with insulin resistance. One of the things you can do is try to get it in the coconut, or in an unoxidized state, and try to get the benefits of the coconut oil from the coconut. The only other thing I could suggest. Yeah, these are good questions. Yes, ma'am.
I have a question. All oil are not good to cook. I know that. But how about for the salad, just the fresh cold-pressed organic olive oil?
You're going to have, it's going to be oxidized. However, I will share this. When Dr. Vogel, he did his his test, the day that he gave them 6 capsules of antioxidants first and then gave them the olive oil, it didn't cause insulin resistance because the antioxidants reversed it. The other test he did was he gave them 6 capsules of antioxidants daily for 2 weeks. On the day of the test, no antioxidant pills. He gave them 50 grams of olive oil, and when he released the cuff, the arteries dilated. No insulin resistance. The antioxidants from the 2 weeks prior protected them from the effects of the oxidized olive oil on the day of the test. So if you're eating lots of antioxidants, then you can offset the effects of oxidized oil. And then the next question is, how much antioxidants do I have to take to prevent how much oil? I don't know. I'm sorry.
Yeah, just want to tell everyone is, yes, we can eat without oil. We don't have to cook oil. Yeah. Anytime we put oil in our food, that means you do jeopardize our health. So
Yeah.
steam, very low cook, the best meal is without oil. Thank you.
Yeah. Their way, it can be done. We're doing it at home, and so yeah, that's ideal. If you get, the question also is how much antioxidants do you need for olive oil, for any oil? The simple answer is if you get it in its natural state, God knows how much antioxidants He had to put in the olive to protect us from the olive oil, and you're going to get the right amount if you eat the olive whole. So, but yes, ma'am.
Last night you had listed nuts, different kinds of nuts, and
Yeah.
I noticed that you put dry roasted next to most of them. Is there a reason for that? Because I heard that from a nutrition friend of mine that if you ate raw nuts, that it has phytic acid and that actually causes Alzheimer's. So is that true?
That's a good question. I have not researched phytic acid in raw peanuts. That's a good question. I don't know. Dry roasted, we recommend dry roasted just because you don't use the oils with them. That's all. But no, I'd have to look that up. If you find an answer, let me know. Yeah. I see. You're saying that dry roasting them breaks down the phytic acid? Is that gets rid of it? Helps it as well. Okay. Oh, very good. Very good. All righty. Yes, sir.
Well, last night you had mentioned with regard to that when we fast, there's like some type of a benefit with regard to Alzheimer's. Can you just like overview that? Just like what benefit is it? Like you said, like when we fast, something happens to our brain. It has something to do with like detoxification or something of that nature.
Yeah. Okay. Well, when you do a short fast, 12 hours, 16 hours, especially at night, your body shifts gears. After a meal, your blood sugars are high, and your body says, okay, we're going to burn the sugar for energy now. We're going to take some of the sugar and store it as fat for later. We're going to take some of the sugar and store it as starch for later. And we're not going to burn any fat right now because we have plenty of sugar to burn. So we stop the fat burning. A couple of hours later, when the blood sugars drop down lower, now the body says we don't have any sugar. We need to keep the sugar up, 60 to 90 in that range. So we're not going to burn sugar now. We're going to save that. We're going to burn fat. So we start going into fat burning mode. In that fat burning mode, we're no longer really burning the sugar, we're burning fat. And in that mode, the insulin level is low, and the brain in that mode starts cleaning up the amyloid plaque. It starts getting rid of it. And so the longer you are in that fat burning mode, the more time you have to burn up the plaque. And that's why you want to go at least 12 hours, and if you have the ApoE4 gene, 14 to 16 hours fasting to give your brain a chance to do that. Why does the brain do that when it's in the fat-burning mode? Well, part of it is, if you remember, the insulin levels are very low when you're burning fat, and the IDE, the insulin degrading enzyme, normally degrades insulin, but if the insulin levels are really low, it can now divert its attention to degrading amyloid. And so now it's burning up the amyloid and instead of the insulin. And that's why the longer period you have for that, the better. Also, in insulin resistance, remember the insulin levels are very high, so the IDE is constantly burning up insulin. And when we check fasting insulin levels in the morning, when the insulin should be less than 5. When people come into Heartland or come into our clinic, and it's typically 20. And this is in a state where they have not been eating anything for over 8 hours. Their insulin levels should be very low, but they're still very high because of the insulin resistance. So they're not going to be burning up their plaque, and that's a problem. So you got to get the insulin levels low. That means get rid of the insulin resistance, and Bredesen tries to do that with avoiding the high glycemic index foods, which is good. But I'm saying another effective way, which is not mentioned in this book, is to avoid the free oils, the oxidized oils, which have been shown to be a problem. So.
And one other thing, did you have any perspective on, I saw on that last slide with regard to herbs, it said the lion's mane supplement. Have you heard anything with regard to that? Because I kind of see it online and whatnot.
The best thing to do would be get his book. I don't recall he has a whole list of herbs, and I don't recall if lion's mane is one of them. That's a good question. He's got, 15, 20 herbs that can be helpful. Yeah.
And the last question.
Thank you. It just what he asked you about the avocado. What I use sometimes is lime, a juice, and then doesn't turn brown so easily.
Yes.
Just take hours to do that. Especially when you're doing guacamole, stuff like that. I use that. It's just helpful. Yeah. It doesn't turn brown.
Yeah, that's excellent. Any acid will help prevent, is an antioxidant, and will help prevent things from turning brown or getting oxidized. I don't know if we have red apples that aren't as acidic. They turn brown faster than the Granny Smiths, which are very tart and acidic. And if you cut up bananas and you don't want them to turn brown, what do you add to you get lemon juice, right? And that helps prevent them from turning brown. So that's the effect of antioxidants. It works in a visible way, and it will also help your bloodstreams.
Thank you so much,
My
Dr.
pleasure.
Emerson. And I will ask Pastor Carol to close us out with a word of prayer. Let's stand.
Praise God. Thank you again. Thank you all for coming, especially our community visitors. God bless you. We'd like to connect with you for a moment. Father, we say thank you. Thank you for this entire weekend. We thank you for last night, this morning, and this afternoon that we've learned and gleaned and been inspired to do better, Father God, to learn about what the preventative measures are, what we can do to decrease our susceptibility to Alzheimer's, Lord. We thank you. Thank you for Dr. Emerson. We ask that you continue to bless him, bless his ministry and his work, Father. We thank you for Dr. Hannah for organizing and connecting. We thank you for her passion for health. And we thank you for each person that has attended, Father, and that will be listening and has listened to our YouTube as well. Lord, help us to receive this information and apply it. As he said, the issue is commitment and continuation. So I pray for that intentionality and that dependence upon you, the devotional, the spiritual aspect as well. We say thank you, Father God. I ask that you bless each and every person here. Bless us to be in good health, to make good decisions with our diet and our cooking methodologies, Lord, and not only to do not keep it to ourselves, but to share with others as well. We ask for your Holy Spirit. We say thank you for an awesome Sabbath, an awesome day, and for each and every person here. Bless us, guide us, and keep us in Jesus' name. Let us all say it together.
Amen. Thank you so much, and have a wonderful afternoon, and join us for the worship service on Saturdays at 11:15.